You see, I wanted to point this out because a lot of parents, and if you've read my book, No Grain, No Pain, the first story in that book I wrote about was a little girl named Ginger. She had juvenile rheumatoid arthritis. Her mom brought her to see me. She was 9. And she had been on methotrexate for about 7 years, from the age of 2 to the age of 9. At the age of 9, the rheumatologist looked at the little girl's mother and said, "Go home. She's got 6 months to live. You need to get your affairs in order." And so her mom, obviously left very disarrayed. You could imagine, being a parent, how that would make you feel hearing that message. Well, when she brought her daughter to me, one of the easiest things in the world we did was change her diet. She had a gluten sensitivity and she was allergic to blueberries, and we made those changes and we saved her life. She's still alive today and she's in remission. And exercise is a part of her life. But all that being said, a lot of parents that have children with rheumatoid, with juvenile autoimmune disease, meaning their children, are scared to want to make them exercise because of the pain. So you can see here, what we're trying to do is dispel that myth. Over the past decades, the role of exercise training in rheumatic disease has been largely explored. Currently, physical activity is well known to benefit patients with osteoporosis, osteoarthritis, systemic lupus, systemic sclerosis, idiopathic inflammatory myopathy, fibromyalgia, rheumatoid arthritis. Therefore, exercise has been considered a valuable tool for treating rheumatic patients. Collectively, studies have revealed the therapeutic potential of exercise in juvenile idiopathic arthritis, juvenile systemic lupus, juvenile dermatomyositis, juvenile fibromyalgia, and other causes of chronic pain. In other words, these kids can exercise. You're not going to kill them. You're not going to make them worse. You're actually going to improve their outcomes. Another study here, physical activity for pediatric rheumatic disease. Standing up against old paradigms. The old paradigm is don't exercise. But the true paradigm is get exercise. 2 to 3 times a week is where you can start. Increasing levels of physical activity can alleviate several symptoms experienced by patients with pediatric rheumatoid disease, such as low aerobic fitness, pain, fatigue, muscle weakness, and poor health-related quality of life. Moreover, the propensity of patients with pediatric rheumatic disease to be hypoactive, often due to social self-isolation, overprotection, parents overprotecting, and fear and or ignorance on the part of parents, teachers, and health practitioners. Ask your doctor if exercise is right for you. Can be detrimental to general disease symptoms. Basically, if the doctor's saying the kid shouldn't exercise and the parents are scared to get the kid to exercise, rethink that, re-strategize. Okay, let's talk about the role of muscle on cardiovascular disease and diabetes. Physical activity represents a natural, strong anti-inflammatory strategy with minor side effects. What are the side effects of building muscle? Muscle soreness. It's called delayed onset muscle soreness, DOMS. It's short-lived. And if you're fearing this, you shouldn't. It gets better with time. If you haven't worked out in 25 years and you go to the gym, go into it slowly. That's going to be a key element, is start slow. Don't overdo it. You don't need heavy weight to do much of anything. You just use body weight, but do something, right? And then as you get that soreness, it'll go away in a few days and you'll recover, and then exercise again, and then it'll happen again, and then it'll recover. But each time you do it, that soreness gets less and less and less. And if you want to reduce this soreness further and recover faster, you can take branched chain amino acids, you can take L-glutamine. Those are good options to reduce soreness. You can take omega-3 fatty acids to also reduce the pain and soreness caused by exercise. But that's about it when it comes to the side effects. I mean, unless you overdo the activity and injure yourself. But again, start slowly and work your way in. But we know that heart disease and diabetes, they're diseases of lifestyle choice. Don't let anyone victimize you into believing they're genetic disorders. They're not. And there's this battle in medicine. It's not really a battle anymore, but you've probably heard this term, nature versus nurture. Is disease nature being genetic, or is disease behavior? And what do most people agree on in this equation? That genetics represent about 20% of disease risk, behavior represents about 80% of disease risk. That's a lot of percent. You can pass or fail with that. You can't pass or fail with that. So you could have the worst predisposition genes and you can still win. And that's what I want you to understand. It's not your father's genes or your grandfather's genes, or, you know, that's a disillusionment. That's what medical professionals have told people, to basically take away their power, regain your power, take it back. It's shared and learned behavior. You know, when we think about family history and disease, it's you learn how to eat, you learn how to exercise, you learn how to behave from your parents and grandparents. And so it's the way you're nurtured. And if you're following along in their footsteps, you're going to develop the similar kinds of disease patterns, not because you have bad genes, but because you have shared behaviors that contribute to the bad outcomes. So keep that in mind. Don't let your doctor tell you that genetics are playing a bigger role in your choices. And it's different if you're born with a truly genetic disease like Down syndrome or cystic fibrosis. That's a different ballgame, though, and that vast majority of people don't have truly genetic conditions. The effect of muscular strength on depression symptoms in adults. This is a systematic review and analysis of the research. And so the aim was to systematically review the relationship between muscular strength, so your muscle, and your depressive symptoms among adults. The systematic review findings suggest that muscle strength has a positive effect on reducing depressive symptoms. Findings indicate that muscle strength is inversely and significantly related to depressive symptoms. Interventions aiming to improve muscular strength have the potential to promote mental health and prevent depression. Thus, public health professionals could use MS assessment, muscle strength assessment, and improvement as a strategy. How many of you have ever gone into the doctor's office and they said, we want to test your strength. Here's a grip strength device. I want you to grip this as hard as you can. Doesn't happen. I mean, it might happen if you go see a good chiropractor. It might happen if you're in a physical therapy office. But, you know, beyond that, you go to a regular doctor, they're going to pull out the prescription pad. Or they're going to tell you to lie on the couch and give you talk therapy. And that's fine. You can do those things. But exercise is important. It's a super important component of making those chemicals that help you feel good. And I want to show you this. This was a really interesting study published in the Proceedings of the National Academy of Science. And it's almost a decade old, not quite, but it was at the time it was a new link. And this is just a quote from the author, one of the authors of the study. There's a clear link between how we move, think, and feel. Think about that. How we move, how we think, and how we feel. The muscles that control posture, our core muscles, have an impact on an organ that is involved in stress. And this is what they found. This is a kind of complex neurological diagrams, but what they found was that the part of your brain that talks to your muscle, and then there's a part of your brain that's similar that talks to the stress organ, the adrenal gland, and in this case, the adrenal medulla. The adrenal medulla makes dopamine, adrenaline, and noradrenaline. Those are stress hormones. And so what they're finding is that your posture, your strength, your muscle control can actually affect your stress levels. This is the magic. If you've ever been to a good chiropractor, this is the magic of chiropractic. Chiropractors have been saying this for over 100 years, is that, and there's a name for it, as a matter of fact, it's somatovisceral response. Or we could use the term disease, somatovisceral disease. What does that mean? Somato refers to muscle. Visceral refers to the organ. So the muscle, the situation of the muscle, whether it's tight, whether it's got poor blood supply, whether it's not moving, the aspect of the muscle affects, through crosstalk, the organ. And in this case, they proved it. Scientifically, they proved it. The muscles are communicating with the brain through the nervous system to the adrenal medulla, which regulates stress hormones. So if your muscles are super tight and they're burdened, that message relay basically affects how you feel. It affects how you think. That's why one of the reasons why I love chiropractic so much is because you can go get an adjustment, and if you're feeling down and blue, you can feel better. Not just in terms of physical, like I have an ache or a pain, but actually somatovisceral responses. I have one of my friends is a chiropractor in New York, and he works in the ER, and his job in the ER, which when he told me this, I was really floored that the hospital there was so progressive, but this is a case where they're actually ahead of the curve. But in this ER, when people have a heart attack, some of them are having what they think is a heart attack, at what we would call a pseudo or false heart attack. And so what happens is they go in, they think they're having a heart attack. The doctors in the ER will make sure, okay, they'll run the right labs and say, oh, you're either having a heart attack or you're not. If they're not, if they're having a pseudo heart attack, they take those patients and they get them adjusted. They get them chiropractic care in the hospital. He works in the hospital. So they send them right over there, because when you have a heart attack, a lot of times it's that radicular pain, that's that radiating pain that travels down your left arm. Well, somatovisceral, you can have a tightening or a stress response in your muscles in your mid back and in your upper and in your lower neck that leads to a dysfunction of the heart muscle. In other words, the muscles affecting the heart. And so getting that adjustment corrects that response, and then they walk out of that hospital not feeling like they're having a heart attack anymore. Anyway, my point in saying all that is your muscles control and communicate with your other organs and can have affects on those organs that can impact the way they make their chemicals. In this case, we're talking about the adrenal medulla. Dopamine, adrenaline, and noradrenaline are impacted by the muscle tonicity and the way the muscle communicates to the brain and through those neurological pathways.